Thank you. Thanks, guys, for coming and welcome. My name's André. I'm from Kids Aid Australia. And today we're going to talk about probably the most common presentation I see come to my emergency department come day or night, and the most common presentation that freaks out people like you, parents with little ones, and that's fever and viral illness. So what is a virus? Basically, a virus is a germ that causes infections. A common cold, gastro, the flu, bronchiolitis, they are viruses. And they are extremely common, especially in children. And 95% of the illnesses that affect your little children are going to be viral in nature. Okay, 95% of them. Now, it is common for children to get at least 6 to 8 of these minimum a year, depending on the literature you read. And the reason for that being is your little ones have a very poorly developed immune system at birth, okay? And it's also common for children to get sick from one infection straight after they get better from another one. And this is when we get parents saying, my child is sick all the time. It's not that they're sick all the time, it's that their immune system isn't that developed that automatically they get unwell from a secondary viral infection. However, as your child gets older, the incidence of these illnesses will get less and less and less. So, what are some of the common symptoms of viral infections in children? And they differ not to the symptoms that we get. So, shout them out. Anyone, what are some of the common symptoms you guys get when you're sick? Sorry? Sore throat, yep. Runny nose, fever, tired, absolutely. These are some of the common symptoms. You generally feel unwell, blocked runny nose, sore throat. You can get a cough and you wheeze and you get red watery eyes. It's common to get a rash either before, during or after an infection. And they get messy. There's vomiting and diarrhea, and that's not fun for anyone. They can get abdominal pain and they can get headaches. You can see they get really lethargic and they want to sleep more. They don't want to eat or drink. Personally, I don't care if they don't want to eat. I want to know if they're drinking, all right? And in the infant, because they can't tell us what's wrong, often irritability and poor feeding are the only signs you guys are going to see that something is wrong. And that's when we get parents coming up saying, I don't know what's wrong with my child. They're just not right. Something is not right with them. And as we've said, I think it was somewhere here, the number one most common frightening symptom of all is this one, and that's fever. And it's funny because we've turned this into an entity in itself. We used to say my child's got a fever. Now I have parents and grandparents coming up saying my child has the fever. We've turned it into an entity in its own. So what is fever, okay? Fever is basically the body's temperature above 38 degrees. And it is a sign of infection somewhere in the body. We don't know where, that's our job to find it. But it tells us that there is an infection somewhere in the body. However, fevers are common. They are common, and they are common especially in children. And the fever in everyday childhood infections in your children is itself not harmful in any way, shape or form. And it is actually your child's body, its immune system, trying to fight off what's going on. So, a little bit of physiology for you guys. The bacteria and the viruses that invade your children's bodies, they love normal body temperature. Normal temperature, 36.5 to 37.5. They go nuts. It's party time. When the temperature goes up, those viruses, they cannot function successfully. They cannot replicate successfully. So a fever is essentially your child's immune system doing what it was built for. Okay? It shows us a robust immune system. And it is the virus or the bacteria that is the enemy, not the fever itself. Fever, therefore, we say, is actually a symptom of disease, not the disease itself. It's no different to the runny nose, no different to the cough, no different to the lethargy. A high fever does not necessarily mean you have a sick child. And the higher the number does not automatically mean the sicker the child either, okay? Fever is the way your child's body fights the infection. Just think when you have a temperature or when you are unwell, what does your temperature do? Does it always stay up here? Or does it go up, down, up, down, up, down, up, down? It goes up, down, up, down, up, down. And your child's temperature will do the same thing, okay, until the underlying infection goes away. And this is the immune response. So how do you guys treat fever? How are we going to teach you at Kids Aid how to treat fever and viral illnesses in your children, whether they're 3 weeks of age or 13 years of age? If your child has a viral illness, they are likely to get better on their own. Okay, and antibiotics will not be helpful in any way, shape or form. It is up to their own immune system to fight these things off. And we know now, we're hearing in the news and the literature that we now have all these infections that antibiotics used to treat and they're now not working anymore, okay, because we're overusing antibiotics. The best treatment for a virus is plenty of rest. Plenty of rest, keep up your fluids. Don't expect your child to be the same happy, bubbly self they are. I get so many people come to emergency and go, they usually jump around, play, scream, yell, happy, happy. And I think, well, how do you feel when you're sick? I know myself, last time I was sick, I called for the priest. It was messy. My wife was going to kill me. But we expect our children to still be happy and jumping and playing and all these sorts of things. Your child is likely to feel better on their own, and it may last a week or two. The aim of the game with your child who has a fever or a viral illness is to make them comfortable. Let me say that again. The aim of the game is to make them comfortable, okay? We don't do the tepid sponging and the fanning anymore. We used to, but we don't, because what that does is causes your child to shiver. And as they shiver, the temperature goes even further up, okay? What we want you to do is dress your child in enough clothing so that they don't shiver. However, they are cool and comfortable, okay? So, don't overdress them, put clothes on them, but don't overdress so they look like this. Because this child looks like he's going to Mount Everest. And if you brought your child in like this to me with a temperature of 40, what do you think the first thing I'm going to do is? Take clothes off. And you or your parents are going to look at me with evil eyes and say, what are you doing, you crazy man? So this is not what we want. We want you to give your child small, frequent liquids and fluids, okay? Water, cordial fruit juice. Have you guys heard of Hydrolyte, the rehydration formula? Okay, great stuff, comes in powder. Also, you make up, also comes in icy poles. For the bigger kids like you and me, also great for a hangover, but I never said that. If your child is less than 6 months of age and you breastfeed, then do that more often. If you give them the cool boiled water in between, then do that more often as well, all right? Infants and babies tend to breathe through their nose. And if that gets blocked, it's harder for them to breathe, therefore it's harder for them to feed and they stop feeding. So you can get from the chemist, you can get the little saline drops or the Fez spray. A couple of drops up each nostril will clear the nasal passage, easy to breathe, easy to feed, okay? I want to know how many wet nappies your child is having. Why is that? Sorry? Make sure they're hydrated, absolutely. So I could tell you that textbook amount of wet nappies for a child is maybe 4 to 6. But I'm going to actually tell you, and kids are going to tell you, I don't care. Because I don't. Because you guys know what's normal for your child. You know how many wet nappies they normally have. I've done a course once, and a lady over here said, oh, my child has 8. And a gentleman over here said, my child has 30. And everyone stopped, and we all looked at, and what are you doing to your child that they have 30 wet nappies a day? The point is, you know what's normal for your child. Anything that's less and deviates should send up a red flag to you, okay? So watch for signs that they're getting dehydrated and watch for signs that the illness is getting worse. Now, your child is still hot. They still have a fever. You've done the cooling and the dressing in layers and all that stuff, and it's not working. What else can you do? What else can you give your child to try to make them feel better? Everyone seen this? Heard of this? Panadol, paracetamol, yep. It is not always necessary to treat a fever. Let me say this again. It is not always necessary to treat a fever. And if you think I'm sounding crazy now, wait for this next one. There is absolutely no advantage to lowering your child's temperature than one thing and one thing only, and that's comfort. Now, when we put these presentations together, we get the latest scientific data and the best evidence-based practice, and we go to the leading authorities in the field. Everything that you're seeing here and now from Kids Aid on fevers and viral illness has come from the Royal Children's Hospital, the people that we are urged and encouraged to trust and believe. This is from them. There is no advantage to lowering your child's temperature apart from comfort. Remember, fever is the body's natural way of fighting infection. Okay, it's the body's natural way of fighting infection. And the fever in everyday childhood infection is normal. And it is your child, your infant's body, their immune system trying to fight off what's going on. And our studies have actually shown that if we keep trying to suppress that fever, suppress that immune response, your child's underlying infection can last a lot longer. Okay, does that make sense, guys? If we keep turning down the immune response, there is nothing to fight off these viral infections. If your child seems well and reasonably happy, there is no need to treat a fever with Panadol or Nurofen. Okay? But let's talk about Panadol and Nurofen because they are great drugs and I use them with my little one as well. If the fever is above 38 and your child is miserable, they have pain, sore throat, sore ear, they're agitated and miserable, you've done everything you can to calm your child. You've done the rocking, the watching the TV at 3 in the morning, you've driven around the block 5 times, nothing is working. This is when your child is miserable and uncomfortable. This is when we want you to give them some Panadol and or some Nurofen, okay? Panadol and Nurofen may not make the fever go away, but the aim of the game is to not make that fever go away. The aim of the game is to make your child comfortable, okay? I've seen children with temperatures of 40 and they're running around playing happy, playing a PlayStation. And I've seen children with fevers of 38 and they're screaming their heads off, heads spinning around like they're possessed. Does the kid with a temperature of 40 who's playing a PlayStation need medications to bring that temperature down? But the child with a lesser temperature who is unwell, in pain, crying, distressed, do they need it? Absolutely. Can you see where we're going with our thought process? Now, paracetamol is a common ingredient in a lot of medications. Panadol, Panamax, Dimetap, Dimedon, Tylenol, so forth. So if you're giving paracetamol to your child, just make sure they haven't had any of these other medications in the last 4 hours, all right? Now, Panadol and Nurofen are far more effective if you use them interchangeably, so together. Because what's in Panadol is not in Nurofen and vice versa. So if you were to come to me, to my hospital, my emergency department, and your child was over 3 months of age, because we don't give Nurofen to children under 3 months, I would give them both at the same time, Panadol and Nurofen. And then if they were still unwell to the point they were distressed and irritable and I couldn't console them, in 4 to 6 hours' time, I would give them one of those medications. And then in 4 to 6 hours' time, if they still clinically needed it, I would give them the other one. So I'm chopping and changing, because we find that this works best. Now, we don't want you to give these medications for more than 2 days without seeing your doctor. And as always, we want you to read the labels and follow instructions so you're giving the right dose, the right medication at the right time. When should you see the doctor? Okay, when should you see this guy? You actually can go to your local doctor if your child has a fever or a viral illness. You do not need to rush into people like me who wear pajamas for a living. So you can go to see your local doctor if your child has a fever, but with that fever, they have a headache. With that fever, they have a stiff neck, or the light is hurting their eyes. Or with that fever, they have persistent vomiting. And we're not talking vomit, vomit, and another one there. It's vomit, 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 vomit. That's continuous vomiting, because we're worried about what? Dehydration in these children. Okay? If they are not drinking for at least 15 to 24 hours, we want to see your child. And if they have dry nappies, whether it's less than 6 to 8 or less than 30, whatever's not normal for your child, we want to see them. If they have a rash with their fever, we also want to see them. Now, lots of parents get really freaked out about rash. There's only one rash we really care about, okay? So if you see a child's rash, either get your finger and push down on that rash or get a glass. Push it against that rash. The rash should disappear and then come back when you release the pressure. If it does that, happy days, we're not worried. But if the rash doesn't disappear and the rash is red or purple and it doesn't change when you put pressure and release it, that is a concern. That is when we want to see you immediately with a rash. If they're more sleepy than usual, or if they've got pain and it's not responding to the medications that you've been giving for over 2 days, we want to see your child. And if you're concerned in any other way, then see your local doctor. When should you go to hospital, or when should you call an ambulance or AAA with your child who has a fever? If your child has a fever and they are very pale, they are very lethargic, and they are hard to wake, that is when we want to see your child, okay? If your child with a fever has trouble breathing, that is when we want you to call an ambulance or come to hospital. And if your child is under 3 months of age, okay, I'm going to tell you now, forget the local doctor. Just come straight to the hospital, because children under 3 months of age have a very poorly developed immune system. They can get sick very easily. And 99% of the time, if you brought your child under 3 months to me, I will admit this child for at least 24 hours to keep an eye on them. There might be a series of tests that we might want to do, which GPs just will not do. Okay, so I'm trying to save you guys time. If you have an infant under 3 months of age and they have a fever or are unwell with a fever, just come straight to the emergency department, all right? That is fever and viral illness, okay? There's possibly some different concepts and theories that we're talking about now, which may change some of the thinking that we've had. But this is the latest evidence coming from all the leading researchers on how to effectively treat fever and viral illness in your little children. Now, I'm happy to take any questions you like. If you have any more questions, we run out of time, please come over to the Kids Aid stand. We're in D11 at the Priceline stall. Everyone who chooses to come and book a Kids Aid course today, and we don't talk about fever and viral illness, we talk about how to save your child's life if they were to stop breathing or lose a pulse. We talk about the most common reasons you come to see me in the hospitals. So fevers and viral illness and febrile convulsions and seizures, burns, drowning, allergies, anaphylaxis, choking, all that stuff. We come to your home, we teach you in your home, we bring the mannequins, we have some fun. If you guys were to book a course here today, you guys get it for free. Okay, if you get a group of 10, they get a 10% discount. They get a 250-page ebook at the end of it. They also get a Priceline voucher that they can use in their store. Okay, so massive incentives to come along and book a course, because our aim is to take parents like you and turn you into your child's superhero by giving you the knowledge, the skills and the tools to be able to recognise and manage what to do if something were to go pear-shaped with your child. Okay. Also, if you like, Panadol, just over there. You can go and win one of 5 baby first aid courses if you scan your QR code thing and so forth. So that's cool, you get to win one of the courses. Those courses are Kids Aid. And I tell you this not because I'm giving myself a big head, but because we all know Panadol and trust Panadol. And they have chosen Kids Aid as their leading provider of paediatric first aid and CPR throughout Australia. Okay, so you can win one of our courses there, and you can double dip and get one for free if you book it here and today. Okay, guys, thank you for coming. If you have any more questions, we're also running some little demos and more teaching sessions over at the Kids Aid Priceline stall. Does anyone have any questions they would like to ask before we finish up? Let me come over here. Do we have a question? We have a cough? He's got a cough. He looks well. Any questions, guys? Does anyone? Yes.
It's wet clothes and everything. To put something wet and cold close to the neck or something good for the fever, treat the fever.
So the question was, can we put something wet or cold on the pulses to reduce the fever? Look, you can if you like. That's probably not going to hurt too much. But the thing to be mindful of is the way, to explain this really quickly, the way your body works out temperature. It's got an inside temperature, your core temperature, and an outside temperature. So if the inside is 40, your body says, hey, I'm hot. But out here, we're 20 degrees. So there's a difference. So the body says, oh, I'm freezing. So it starts to shiver to warm itself up. So if you start to put cold compresses on all these pulse points, you could trick the body into thinking, hey, I'm really, really cold. And then it will start shivering to warm itself up, which will increase the temperature even more. My advice would be, give it a try. If it works, beautiful, happy days. If you don't think it's achieving anything and or making it worse, then stop. Either way, it's not going to cause any damage and you're trying it out. Any other questions, guys?
Is it okay to use Panadol when they're teething?
So the question was, is it okay to use Panadol when they're teething? Absolutely okay. So we're not giving the Panadol to the child to bring out a fever. We're giving them because they're teething and they're in pain, and we want them to feel comfortable. Because if they don't feel comfortable, then they make your life uncomfortable, and then they don't feed because they're uncomfortable and in pain. So absolutely, that would be the right reason to use something like Panadol or Nurofen. They're in pain, we want to make them comfortable. Absolutely. Bonjela is also good. Rub it on their gums, that sort of thing. Yes, hello. Let me come over.
Do Panadol or Nurofen help with baby coughs? Like if they had a cough, would you give them Panadol to help relieve that?
So the question was, do Panadol and Nurofen help with coughs? The answer is, with cough specifically, no. It will not stop a cough. Some medications like Nurofen specifically, if you have things like asthma, these medications, Nurofen, they're called anti-inflammatories, non-steroidal anti-inflammatories, Nurofen, Voltaren, and so forth. They could actually bring on asthma and a cough. So if you are allergic to them for that reason, you don't take them. But they will not suppress a cough. It won't relieve the symptoms of cough, but it might make your little one feel much better because the coughing can cause pain from all the ribs moving too quickly and so forth. So it can make him feel more comfortable. Yeah. Any, like, yes, can I? Yeah. All right, here we go.
Febrile seizures.
Okay, the question was febrile seizures. What is one? Basically, if the fever gets high to a point, your child can fit and have a seizure. Okay, and they're very scary, but easy to manage. Really quickly, if your child's going to have a febrile convulsion, it's going to happen. You will not be able to stop it by giving them Panadol and Nurofen. Body doesn't work that way. If you want to know more about febrile convulsions and how to manage them, come over to the Kids Aid stall. We have a febrile convulsion slide set, and I'm more than happy to run through with you how to manage it, what to do. So you can become, again, your child's superhero. Come to the stall, my friend, and we can have a chat to you there. Thank you, guys.